Team. So once again, good evening, everyone. My name is Dawn, your NC for this evening session. So first of all, I would like to thank EVG Global Network and my upline for introducing Elite Career into my life. I would also like to thank all of you for taking your time to join us this evening. So actually, before we begin, our EVT has actually put your Zoom on mute to allow the session to run smoothly without any interruption. So later on, we'll have a Q&A session. If you have any question, you can unmute to voice your question. But of course, you may actually, use the mute your mic and then use the chat function over here to type in your question. So actually, picture will be displayed during the presentation. If you can't see clearly, you may zoom in for a clearer view. All right. So actually, medical science is so advanced nowadays, but why are we seeing more and more hospitals, community centers, nursing home, or even hospice ramping up more beds? Actually, shouldn't the advancement of medical science helps to decrease the number of patients? And why can we see more and more people in the age group of 30 to 50 detected with cancer? What should we look out for in cancer? What is the difference between medical and preventive science? So I'm actually quite sure we want to find out more. That's why we are here today. So let me now invite the speaker for this evening to share the topic, The Silent Killer, Cancer Part 1. So let's welcome Charlie.
Okay, good evening, ladies and gentlemen. Okay, firstly, I'd like to thank EVG and my upline. Okay, my name is Charlie, and a big welcome to all of you for attending tonight's webinar. Okay, let me just share the slide, please. All right, so the topic for this webinar is cancer, the silent killer. So actually with a heavy heart, let's get to understand what exactly is cancer. Okay, in fact, I have actually seen a lot of people panic and at a loss of what to do when they are faced with cancer. So besides having to burden with costly medical expenses, the patient themselves suffered the most, right? So having to undergo the kind of pain during treatment and the constant worrying of any chances of recovery after treatment. So even family members will be equally as worried. They have to face the reality that the family member might not make it through. So therefore, the entire process is truly tormenting. Okay, a lot of cancer patients actually pass away shortly after they are diagnosed with cancer. So this gives people the impression that they are sentenced to death the moment they get cancer. So is this really the case? Right. And can cancer be prevented? So cancer is indeed scary, but if we don't understand about cancer, then it is even scarier. Tonight, let us really get to understand about cancer and prevent it from ever happening. Okay, cancer is actually like a silent killer. There is actually no warning at all when it's devouring our health. As you can see from the next slide, okay, according to World Health Organization, cancer is world #2 killer. Okay, cancer causes 1 in 8 deaths globally. Okay, cancer takes away 10 million people yearly. Okay, speaking of this, we tend to worry for someone when actually they get COVID. Am I right? But then, can you imagine 10 million people die from cancer yearly? And this is actually 1 cancer death every 3 seconds. And actually predicted by year 2032, the number of cancer deaths will increase to 13 million annually. Okay. In fact, the next slide tells you, cancer cells are actually mutated from normal cells. Okay, the red one on the left side are normal cells. Okay, normally, the cells are divided. The cells divide and multiply in an orderly manner, and cells can actually live up to 90 to 180 days. Okay, children and infants have the fastest growth. I'm sure you know that. However, okay, some organs stop reproducing when they reach a certain age. Okay, for example, okay, women during menopause will not be possible to get pregnant. Am I right? And but The main difference is, okay, normal cells will go into apoptosis, meaning they will die off. But if it is injured or cannot be repaired. Okay, picture on the right actually shows, right, okay, when cell apoptosis malfunction, normal cells will mutate into cancer cells. Okay, they will actually continue to grow and divide forever. Okay, we call these cells immortality cells. Okay. So what exactly is cancer? Okay. Cancer is a condition in which these mutated cells are uncontrollable and will multiply and grow in large numbers. Okay, and then they will destroy our normal bodily functions. Okay, in other words, okay, they will invade and even occupy our organs until the organ malfunction. Then the person will die when cancer cells destroy the immune system. The next slide. Okay, so can cancer be easily prevented? Okay, in fact, Dr. Zhao Hui Chen mentioned before, cancer does not happen overnight. Okay, for a cancer to happen, right, we have to commit the same mistake 100 times. Okay, in fact, cancer cells does not grow and divide as fast as we would have imagined. Okay, imagine, okay, from one cell split into two cells split into four cells split into 8. It takes about a few months, right, for it to actually double up. Okay, and some cancers even take 6 to 8 months for it to double. Okay, the next slide, all right. Okay, so when the amount of cancer cells reaches 1 millimeter, which is 1 mm, it's like making a period mark with a pencil. No, okay, so that period mark, there's about 1 million cancer cells on that period mark, and only the most sophisticated medical equipment is able to detect it. So then, if cancer tumor were to grow to 1 centimeter, which is 1 cm tumor, okay, it's like the size of an eraser at the back of the pencil. Okay, you can actually refer to the picture. Okay, that already have about 1 billion cancer cells, and our body, right, may not detect any tumor smaller than 1 cm. So usually, those tumors that have been diagnosed, right, are at least 2 to 3 cm in size. And do you know that cancers are already in the terminal stage? So when a malignant tumor grows to 10 cm, that's when a person is already on the verge of death. Why is that so? Okay, because, right, there are about 60 to 80 trillion cells in our body. Okay. Okay. And when the number of cancer cells is enough to destroy an organ, it will cut off the blood supplies to other organs. Okay. And at the same time, okay, it will weaken the body, right, ability to clot, okay, which in turn causes some cancer patients dying of hemorrhage. And the toxic side effects from some cancer treatments, right, can also suppress the function of our immune system. Right, next slide. Okay. In fact, 2/3 of the time, cancer stays hidden. It cannot be detected. We won't know it, right, when a cancer is produced in our body. Okay, this is a so-called incubation period. Okay, let's take a look at the duration it takes for different cancers, right, to grow from 1 cm. Okay, for example, breast cancer takes 6 to 8 years. Okay, colorectal cancer takes about 10 to 20 years. Lung cancer also takes about 10 to 20 years. Okay, so for example, if a woman is diagnosed with breast cancer at the age of 40, okay, it means that she has gotten cancer at the age of 32 or 34 years old, right? So for example, okay, if a person is diagnosed with, let's say for example, if a person died, okay, just give me a second. So for example, if a person is diagnosed with breast cancer and this person always had regular checkup, but why it wasn't detected in the first place? Okay, in fact, this is what we call the incubation period, and it is not detectable by general devices. Okay, in fact, 2/3 of the cancer period we are actually unaware of. So preventing cancer, right, is always the wisest choice. Okay, next slide. Okay, you can see. So what are the differences between benign and malignant tumor? Okay, benign. Okay, the benign tumor is actually non-cancerous. Okay, they multiply at a slower rate. Okay, tumor that only grow in the same place usually do not metastasize to other parts or spread, such as cysts, warts, moles, polyps, etc., etc. All these are benign tumors. Okay, so generally speaking, okay, these tumors, right, can be removed by surgery without posing any health threat. Okay, so if the tumor cells are completely removed, they will usually not recur. Okay, and the arrangement of these benign cells, right, are relatively neat, right? So, but if it's a malignant tumor, it is cancerous. Okay, and they grow rapidly and have obvious features. Okay, under the microscope, okay, the cells of these malignant tumors are usually irregular and do not have a uniform structure. Okay, in this sense, it just represents the chaos brought to the body by malignant tumors. Okay, even if surgically removed, okay, malignant tumors, right, can still metastasize or spread to other parts of the body, causing cancer, right, to recur. So before being discovered, okay, a tumor may contain millions of genetically identical and destructive cells. Okay, I'm sure by now, right, you are able to differentiate better. Okay, in fact, we often heard when some people are diagnosed with cancer, they will start to doubt, why is it me? You know, why me? Why me? You know, what did I do to deserve this? Okay, they often feel, that they are living healthily and actually they pose no threat for risk cancer. Okay, in fact, cancer occurs silently. Okay, which makes it very difficult for people to understand, and which also, right, increases the difficulty of diagnosis and treatment. Okay, sometimes it seems that everything seems fine on the surface, but cancer may still be lurking somewhere in the body. So the only way to fight cancer is early detection. All right. In fact, our body is actually very smart. Okay, but our internal organs cannot communicate directly with us. They can only alert us via some symptoms of pain that we can see or feel on the surface. This is also the precursor of cancer. Okay, right. So next slide. Okay. Okay, let's look at the first signs and symptoms of cancer, which is the appearance of lumps or thickening in some parts of the body. Okay, so for example, okay, when women go to a obstetrics and gynecology clinic, which is commonly known as OG clinic, okay, the doctor will teach them to actually touch and feel the limb around their breast. You can actually see the picture. Okay, when the breast lump or thickening that feels no different from the surrounding tissue, okay, and enlarged lymph nodes under the arm, okay, doctor will recommend them to do further examination. Okay, because most breast cancer have lump or thickening signs and symptoms. Okay, some people will, have discharge from nipple. Okay, and this discharge is not the kind of milk that produced during pregnancy. Okay, and some will have a retraction of the nipple, change in skin of the breast, such as dimpling or puckering, redness or swelling. Okay. Okay, actually, breast cancer takes place, right, most commonly among women. So women, right, have to constantly check their breast and lymph nodes under the armpit for any abnormalities. Okay, but of course, breast cancer not only occurs in women, but men as well. So it's just that the chances in men are much lower. Okay, but if men get breast cancer, their condition will be way more serious, right? So next slide. Okay. Another lump of thickening related testicular cancer is actually testicular cancer, which is the male reproductive organ. Okay, if he has an abnormal lump in his testicle, or he developed a testicular cancer. Okay. Next up, let's take a look at the skin cancer. Okay, so what kind of skin changes are related to skin cancer? Okay, let's look at the signs and symptoms of cancer. Okay, a change in what or more, such as size, shape, color, and texture. Okay, unexplained bleeding. Okay, dry scalp patches, dry scaly patches or pimples that never seems to go away. Okay, constant itchy skin and rashes. Okay, usually, right, only warts or moles are seen on the body at the beginning. Okay, then again, okay, actually, have you actually encountered some people, right, having a lot of warts? Okay, their appearance is actually somewhat similar to corns. Yeah, corns. Okay, but corns are actually not a sign of cancer, but warts may develop into cancer because it is caused by virus. Okay, some people may actually develop one or two at first, but then we have to observe whether its shape, color, structure have changed. Okay, it will actually have some changes if that is cancerous. Okay, such as it's getting bigger, spreading more and more, changes in the shape, changes from light brown to dark color. Okay. Such a situation, right, may also be a precursor to skin cancer. Okay, the structure change is not only the shape, but it will also pop out or dent and became like 3D like, So if it's not a single transformation, but a variety of changes in shape, size, and structure, you actually won't feel any pain when actually touching it. Therefore, many people will just ignore it. Okay, and some people will treat it like having corns. Okay, therefore, people with warts or moles, right, should pay attention to whatever these warts have actually the above mentioned changes. Okay, so let's look at the next slide. Skin. Okay. Another type of skin changes, right, related cancer is actually non-Hodgkin lymphoma. Okay, this type of cancer patient actually first started with itchy skin, rashes. Okay, however, their skin disease show these symptoms, right, they will actually treat it as a general skin disease. They will actually take steroids and anti-puritic drugs when actually they feel itchy. Okay, they would even, right, they would actually never have thought that this was actually signs of cancer. Therefore, they didn't actually consult a professional doctor. In fact, some itchy skin or rashes, right, will eventually become non-Hodgkin lymphoma, as shown in the picture. Right. Let's take a look at the next picture. Right. Did you actually see a lot of ulcers inside the mouth? Okay. Do you find it quite common? Okay. In fact, this could be due to being heaty, late night sleep, or having a deep fried food. Okay. Sometimes we will actually have mouth ulcer for a couple of days when we accidentally, bit our tongue while we are eating. And actually, and this will actually recovers after a few days. Then, if that's the case, right, that is not signs of oral cancer. But if it is oral cancer, from mouth, tongue, or throat cancers, then the signs will actually be, persistent sore throat, difficulty in swallowing, which is actually difficult in eating. This could also be a sign of throat cancer, which will actually affect this person's appetite. If mouth and tongue ulcers, right, having mouth and tongue ulcers all year round, oral bleeding, is not the same as the external bleeding. For example, as soon as for actually those external bleeding, we will actually bandage it as soon as possible. But for oral bleeding, right, you actually flow backwards, such as oral bleeding during sleep. When we actually wake up to discover the bleeding, we won't, right? So usually, right, we will only realize it while brushing our teeth. If some people all year round having foul breath and some serious loose teeth, they will actually just fall out without any cavities. Loose teeth, alone, right, may be periodontal disease. But coupled with other symptoms, it is more likely a precursor to oral cancer. Some people, right, in fact, some people have actually this oral discomfort, which they will have changes in actually speech pattern. Let's look at the next slide. Let's take a look at what are the signs of lung cancer. Some people have actually this chronic cough, which may be signs of lung cancer. If coughing out blood, it is actually quite serious. If coughing out blood and wheezing, enlarged lymph nodes in the neck, then but then sometimes actually you don't feel it. When lymph nodes starts to swell, some lung cancer patients even have signs of chest pain. This kind of cough I mentioned right here are not the kind of cough that will actually recover after a few days. Even it is a whooping cough, also known as a pertussis cough. It will actually stop after some time. This kind of a premonitory cough, right, of lung cancer is actually chronic. You can actually see the person coughing all year round. This, right, you have to be mindful. Because okay, because it is very difficult to treat lung cancer. Actual fact, a lot of non-smokers actually come down with lung cancer, okay, because it is due to actually inhaling of secondhand smoke. Okay, some people will still get lung cancer even they don't smoke. Okay, or some people around them also don't smoke. Okay, okay, let's look at the next slide. Okay, okay. So next up, okay, let's look at the female reproductive system. Okay, abnormal vaginal bleeding. Okay, and the possible signs of ovarian, cervical, uterine cancer. Okay, okay, this kind of bleeding is actually different from menstruation. Okay, it is having an abnormal vaginal bleeding, pelvic or lower back pain. Okay, in fact, our body always gives us a lot of symptoms. Okay, so it is important for women to get themselves checked regularly. Okay, why is it people often have this impression, right? That their days are numbered whenever they are diagnosed with cancer. Okay, it is because cancer tumor, right, already grown to 10 cm by the time it was diagnosed, okay, and it is already too late by then. Okay, so please do consult a doctor early, right, when you actually discover these signs and symptoms. Okay, with early detection, even if it is cancer, okay, the success rate from treatment will be relatively higher. Okay, next slide. Okay, next up, right? Okay, let's take a look at if there's actually changes in the bowel or bladder habits. Okay, then it could be signs of kidney, bladder, or prostate cancer. Okay, okay, those are blood or pus in urine. Okay, so so do we actually bleed? No, when we secrete? No, right? I'm sure we don't bleed when we secrete. Okay, okay. Let's sidetrack a little. Okay, you may actually feel that protein is discharged when you get urine bubble when you pee. Okay, in fact, sometimes pregnant women discharge protein via their urine when they pee. Okay, and all these are abnormalities, right? It is best to have it checked. All right. Okay, but nowadays, okay, a lot of people, right, rarely notice it even if there's blood or pus in their urine. Okay, it's because they actually immediately flush, after they've done their business. Okay. Some even just walk away, without even looking at it. Right. Okay. Some don't even turn on the toilet lights at night. Okay. So you have to actually pay attention, right? If there's burning pain during urination, okay, it is a very painful process, and often feels really scary, like whenever these people actually visit the toilet. It could be caused by kidney stones, or it could be kidney cancer, bladder cancer, or even prostate cancer. If it is back pain or pelvic pain, it is also related to these cancers. So please do not underestimate it if there's any changes, right? If there's any changes in bowel bladder habits. Okay. In recent years, I actually often heard from people around me, right, that even, right, having checked few times, they actually thought it was actually a uterine inflammation. Okay, having blood in the urine. Okay, some children experience pain, right, when actually they urine. Okay, so doctors actually give them antibiotics to actually resolve it. But after a few years, I heard, okay, that that what they had was actually cancer. Okay, let's look at the next slide. Okay. So next up, changes in bowel bladder habits may also be signs of colorectal cancer. Okay, in fact, our food is consumed in the body via our esophagus. Okay, then absorbed by our small intestine, and then and those that our body doesn't require will be excreted via the large intestine. Okay, the large intestine, right, is actually very long, and actually requires a lot of fiber to help actually excrete smoothly every day. So, and if unwanted food is not excreted within 24 hours, okay, stool will be formed and a lot of toxins will be produced. Okay, therefore, it is closely related to colorectal cancer. Singaporeans actually love red meat. Okay, and this in turn, right, make colorectal cancer, right, so deadly. Okay, and the risk of right, is actually 2.2 times higher than average person who don't consume so much red meat. Okay, and currently, right, there are about 1,000 new cases every year. Okay, this is actually due to red meat is harder to digest. Okay, and it will actually become stool in the large intestine, when there is not much, then when there is not enough fiber. Okay, so what are the signs of colorectal cancer? Okay, if you have bloody stools, abdominal cramps, frequent constipation, or unusual, frequent diarrhea, meaning we have digestion, meaning your digestion actually got problem, and some will actually have a loss of appetite. Okay. Okay. So will the cell in the intestine become cancerous if the intestinal tract has these smelly or moldy stools over the year? Okay. Therefore, cancer does not happen overnight. Okay. Those who have been constipated for a long time actually need to really pay attention. Okay. Cancer cells will actually divide and multiply from 1 to 2 becoming 4, and so on and so forth. Okay, let's look at the next slide. Okay, next up, let's take a look. What are the signs and symptoms of gastrointestinal cancer? So you actually got indigestion and nausea. Okay, some people right may think that they have poor indigestion, and it is very normal. But sorry to say, okay, having poor digestion right also means that it is difficult for the body to absorb nutrients from the food. Okay, therefore, when a person come down with cancer, okay, not only right it is related to what they eat, it is also related to what they don't actually eat. Okay, so if a person has poor digestion, do you think this person will actually have enough nutrition in the long run? Okay, so of course it is definitely not enough, right? So instead of saying what he ate, or saying he never eat meat, or then never eat meat, then why still come down with cancer? So actually indigestion, nausea, diarrhea, bloating, loss of appetite, burping, okay, all this, right? Please don't take it lightly. Okay, when you have all these symptoms. Okay, so if you have one or more of these symptoms, right, at the same time, okay, you may think, right, these symptoms are actually pretty common. Am I right? Okay, a lot of people have it, but all these symptoms, right, are unhealthy signs from the perspective of preventive science. Okay, am I right to say that I believe, right, nobody will say that they are actually 100% healthy? Because why? Because sometimes, right, we actually stay up late. We are stressed. Okay, we actually very picky at food, and we only eat those food that we like. Okay, and not choosing, right, those food that our cells actually need. All right. So let's look at the next slide. So what are the other common signs and symptoms of cancer? Okay, such as first one, which is chronic fatigue. Okay, the chronic fatigue here actually refers to unusual fatigue. Okay, so even with enough sleep, some even sleep 8 to 10 hours every day and still feel tired. Okay, some even more exaggerating. They couldn't sleep while they're actually lying in bed, but they fall asleep while they're sitting down. So have you actually seen a healthy person have got tired for no reason? I'm sure you don't, right? So what kind of person, right, gets tired easily for no reason? Okay, that is people who are sick. Okay, second one is actually a sudden and excessive weight loss. It means that the weight reduced very suddenly and rapidly. Okay, have you actually noticed some people reduce from for example, they have 70 kilo weight to 50 kilo weight very suddenly? Okay, it is not. They actually lost 20 kilos all of a sudden. This is actually called sudden and excessive weight loss. In fact, unless, right, that person has plans to slim down, okay, otherwise, right, a sudden drop of 5 kilo could depict he has some problems. Okay, why is that so? Okay, because nowadays, right, it is so hard to lose even just 1 kilo, let alone 5 kilos. Right. So this is actually closely related to our understanding of cancer. Okay, so how does cancer take our life away? Okay, how does it cause a person to die? It is all related. Okay, why does a person come down with cancer and die soon after? Okay, some even died before the course of treatment is over. This is actually because cancer, right? Cancer needs nutrients during their growth process. Okay, but those nutrients, but then again, whose nutrient should they take from? you will actually take from the nutrients that actually store inside our body. Okay, humans, right, need food to get calories and nutrients. Okay, but cancer cell will actually take them first. Okay, because cancer cell will need to divide and multiply rapidly. Okay. Remember earlier I mentioned that cancer cells, right, will not stop multiplying because the nutrients it needs are much more than what our normal cells require. Okay, therefore, right, it will actually take away, right, the nutrients. Okay, when it grows, right, it will steal nutrients from actually infected organs. Okay, for example, let's say my bones need nutrients, but then it will actually steal the nutrients from my bones. Okay, and at the same time release toxins, and this will actually make the organ malfunction. Okay, for example, right, a person, right, cancer appears in his stomach. Okay, originally, right, the stomach is actually used for digestion. Okay, food used to be appetizing, but then one day, this person suddenly felt nauseous, and had no appetite, and actually feel like vomiting. Okay, actual fact, right, this was caused by the stomach was completely occupied by cancer, and it has fully disintegrated, causing the stomach to actually malfunction. Okay, then cancer will also cut off the blood supply to vital organs. Okay, cancer also has the ability to actually weakens our blood's ability to clot. Okay, blood that is supposed to clot but is unable to, right? Okay, which in turn, right, causes some cancer patients to actually die from hemorrhage. Okay. Speaking of hemorrhage, actually reminds me of oral cancer I actually mentioned earlier. Okay, some people will actually bleed every time they have this bowel movement. Okay, they always say no problem, they always say no problem, it's nothing. But then again, healthy people will not have such problem. Okay, if it is hemorrhoids, okay, then right, there must be some problem that actually causes the bleeding during bowel movement. Therefore, have to go for actually physical checkup. Okay. So, okay, why do we see that actually most cancer patients feel tired easily? Because they are anemia. Okay, cancer, right? Cancer also suppress the function of our immune system. Okay, thus causing patients to actually die from bacterial or viral infections. Okay, so even if we only rely on unilateral cancer treatments methods, okay, which I will talk about it shortly. All right, and every method has its side effects, or it will also have a further complication. Okay, next up, other common signs and symptoms of cancer also have swollen lymph nodes. Okay, swollen nodes. Okay, because our lymphatic system is actually our immune system second line of defense. Okay, skin is actually our first line of defense. Okay, all foreign particles, right, and viruses enter our body through the skin. Okay, therefore, therefore, right, it is just give me a second. Okay, just as I mentioned, right, the foreign particle actually enter through our skin, right? Okay, and in fact, the second path, right, is actually lymph. So if lymph nodes are actually swollen, or it is more likely, okay, when they are swollen, right, then it is actually more likely to be cancer. So of course, it does not mean that lymphatic swelling, right, is actually lymphomia. Okay, not necessarily. Yeah. Okay. So if the above symptoms are actually accompanied by frequent infections or flu-like symptoms, usually doctors suggest checking for leukemia, which is actually a blood cancer test. Okay. And also signs and symptoms of non-Hodgkin lymphoma, right, and pancreatic cancer, right. Their symptoms are actually enlarged liver or spleen. Okay. Okay. When the liver is swollen, okay, you can actually see the swelling actually from the chest and above the abdomen. Okay. And then you will have actually solid feeling when you actually touch it. Okay. So what do we do, right, when we discover or check out that we actually have these abnormal symptoms? Okay. Usually we will actually consult a doctor, and doctors common cancer screening methods includes, let's look at the next slide. Okay, includes tumor markers. All right. Okay. Tumor markers, okay, is to actually analyze whether they are whether they are tumor, whether they are tumor markers in our blood and urine samples. Okay, but this actually may not be, but this may not be able to tell the stage of the cancer, including the tumor size, location, and how much it has actually spread. Okay, in general, okay, tumor markers themselves are actually insufficient evidence to diagnose cancer and can be elevated by non-cancerous situation. Okay, for example, okay, raised CA125 tumor marker in the blood test, may indicate ovarian cancer. Okay, it could also result from benign conditions like pelvic inflammatory disease or menstruation and pregnancy. Okay, many a times early stages cancer will not show elevated tumor markers. So tumor markers are usually most effective when used in combination with other diagnostic tools. Okay, let's look at the next slide. Okay, surgical biopsy. Okay, sometimes a tissue sample may be needed to actually diagnose cancer. Okay, an invasive procedure called a biopsy is actually usually performed to take a tissue sample by inserting a thin or light tube through the nose, mouth, or rectum. Okay, statistics actually show that biopsies aren't altogether dependable. Okay, only 11 to 25% with suspicious lesion actually have a malignancy. Okay, fluctuation in the ability to discriminate between benign and malignant cells. Okay, let's look at the next slide. Okay. X-ray is actually generally the most common. Okay, mammograph is actually used to detect tumors in breast. Okay, and chest radiograph to actually diagnose the early stages of lung cancer. Okay, X-ray can also detect cancers of the intestines, stomach, liver, spleen, and kidney. Okay, for example, X-ray, X-ray cannot be seen if a tumor is actually 1 cm or the location of the tumor is actually behind the stomach. Okay, so let's look at the next slide. Okay, you can do an ultrasound scan. Okay, if you actually wanted more details. Okay, these screening methods can actually provide images of developing fetus. Okay, uses sound wave to actually make pictures of internal organs. Okay, and also for detecting cancers in actually soft tissues. For example, breast. Okay, or endoscopic ultrasound. Okay, examine the esophagus and intestine. Okay, let's look at the next slide. Okay, CT scan. Okay, also known as a computed tomography scan. Okay, actually it uses X-ray technology and a computer to obtain cross-sectional 3D images of body, including bones, organs, gland, and actually blood vessels, and actually show not only if a tumor is present, but also how deep it is, and to detect or evaluate if cancer has actually spread to the lungs. Okay, let's look at the next slide. Okay, MRI. Okay, which means magnetic resonance imaging. Okay, it's actually more sensitive than CT scan for distinguishing soft tissues. Okay, however, this radiation from CT scan or MRI are much higher, which is actually bad for our body. Okay, a few people will start with this kind of examination unless they discover they actually have the tumor in their previous examination. So next slide. Okay, so interesting. Okay, nuclear medicine, which is also known as PET scan. Okay, so unlike other diagnostic method, it is to determine if the tumor is benign or malignant. Okay, it actually reduces the number of futile lung cancer surgery actually by 50%. And the biggest benefit of using this method is tumor detected is actually usually at an early stage and very likely curable. Okay, let's look at the next slide. Okay. So whenever a person is actually diagnosed with cancer, he will actually seek medical treatment. Okay, there are 3 common cancer treatments, which is cancer surgery, which is actually surgical removal of tumor. Okay, radiation therapy, and chemotherapy. Okay, some cancers, after surgery, will actually require hormone therapy drugs, such as brain cancer, such as breast cancer. Okay, let's look at the next slide. Okay, let's take a look at cancer surgery. Okay, surgical removal of only parts of a tumor or an entire localized tumor. Okay, for example, Okay, if a woman gets ovarian cancer, okay, the doctor may actually suggest removal of the ovaries. And if the woman is actually old, the doctor will usually recommend for removal of uterus as well, right, to actually prevent from spreading. Okay, actually, have you actually heard before? If it is breast cancer, okay, some will actually have it partially removed, and some will have the entire breast removed. Okay, some breast cancer cells, right, in fact, have already spread to the lymph, and some doctors will actually recommend to have the lymph nodes removed as well. So just imagine, what should we do, right, if a man has cancer in his reproductive system? So, yeah. So, and actually, every surgery actually has its treatment risk. Okay, it will actually stimulate the cancer to spread. Basically, right, the cancer cell could have already spread even before surgery. Okay, complications during surgery also include uncontrolled bleeding and damage to internal organs as a result, okay, of actually tumor removal. Okay, it will actually bring side effects like pneumonia or more prone to infection, internal or external bleeding. Okay, men may suffer from impotency, okay, and lose control of bladder or bowel movement. So surgery alone, right, is not enough to actually treat certain types of cancer. So in order to ensure the elimination of residual malignant cells, right, after surgery, okay, doctors will actually use electrotherapy, cancer chemotherapy, or other types of treatment. Let's look at the next slide. Okay. Radiation therapy, okay, also known as electrotherapy. Okay, actually use high energy radiation generated through X-ray machines or radioactive isotopes, okay, to either completely destroy a tumor or damage cancer cells, okay, or damage the cancer cell genetic material, okay, making it impossible, right, for the cells to actually keep growing and dividing. Okay, radiation therapy usually administered externally. Okay, so using radioactive beams or special radioactive isotope, okay, doctors will actually direct, okay, the treatment precisely at where the cancer cells are present, depth and size of the cancer. Okay, now you imagine. Okay, imagine, right, the intensity of the ray energy. It's actually like cooking food in a microwave oven. Okay, so besides from adjusting the time, the intensity of the ray will actually affect the cooked food. So right, the ray energy intensity, right, for radiation therapy is actually very crucial. So so why do doctors usually recommend electrotherapy? It is actually because cancer cells may spread after doctors find out that the tumor is malignant after it was removed. Therefore, doctors' purpose is to electrocute the cells that may actually mutate around the tumor. Okay. This actually, of course, will actually bring some side effects, treatment risks. Okay, for example, affect glands and bones. Okay, it's actually nasopharyngeal cancer, patient, right, after having surgery, you actually see that they actually have a mouthful. You actually see that they they take a mouthful of food, then they actually mouthful of water. Okay, whenever they eat. Okay, the reason is that the gland that actually secretes the saliva, right, has been destroyed. Okay, which actually makes it difficult for them to swallow the food. Okay, some people may have a darker skin after electrotherapy, and some may even appear to be burned. Okay, so in addition, there will be hair loss. Okay, if radiation therapy is actually applied directly to the head, okay, they will feel nausea, difficulty in swallowing, oral ulcers, and fatigue. Okay, let's look at the next slide. Okay, chemotherapy actually uses cytotoxic drugs to kill fast-growing cells like cancer cells. Okay, chemotherapy's systemic nature, right, makes it better suited to treat cancer that have actually spread to other organs or tissues. Okay, some patients have to actually undergo chemotherapy within 2 to 3 weeks after surgery. It is because they are afraid that it will actually spread. Okay, or in fact, it might actually be too late, right? If they actually waited too long. So so ladies and gentlemen, can you imagine what it will do to you when this poison enters your body. Okay. Okay. It will actually kill cancer cells and our healthy, fast-growing cells at the same time. Okay. Yeah, causing immense damage to our health. Okay. Have you seen some cancer patients undergoing radiotherapy and chemotherapy? Okay. What sort of side effects does it have? Okay. For example, they will have hair loss, fatigue, nausea, vomiting, rashes, depression, throat inflammation, nosebleed, weight loss, anemia, and also they will look pale. Okay. So why vomiting, hair loss, or nausea? Because chemotherapy drugs, right, actually target the characteristics of cancer cells, right, to actually kill it. Okay. Earlier I mentioned that cancer cells are, actually cells that actually divide and multiply rapidly. Am I right? And the cells of our oral cavity, our scalp, and our gastrointestinal tract are also cells that divide and multiply rapidly. Okay, just like our hair. Okay, it will actually grow back after 2 to 3 days. Yeah. Okay, when undergoing electrotherapy or chemotherapy, the cells of our scalp, stomach, oral cavity will actually be killed. So medical treatment, right? In fact, medical treatment is constantly improving. Okay, previously, right, chemotherapy will encounter patient, right, will actually encounter hair loss. But now, right, some of this patient doesn't, some of this chemotherapy doesn't have such effects. Okay, therefore, Dr. Chow Fei Chen, right, refer to cancer treatment as a form of gambling. What does that actually mean? Okay, it means, right, it means actually gambling on whether we kill the cancer cell first or we kill our healthy cell first. So no matter what kind of cancer, doctors always remind patients what they need to. Okay, doctor always remind patients, right, that they actually need to maintain their weight. Okay, they also have to pay close attention if their weight keep dropping during the course of treatment. Okay, let's look at the next slide. Okay, we have actually talked about various cancers and their precursors, okay, and the treatment methods. Okay, let's understand about SEER, cancer data review, right, from 1975 to 2013. Okay, the National Cancer Institute statistics on the 5-year survival rate of various cancer treatments. Okay, so what is the 5-year survival rate of cancer treatments? In other words, when a patient, right, has completed all their surgical operations, radiotherapy, chemotherapy, and there is actually no recurrence within 5 years, right? Within 5 years. This is called the 5-year survival rate of cancer treatment. So let's take a look at which cancer, right, has the lowest survival rate within 5 years. And the first one is pancreatic cancer. Okay, it has actually a relatively high mortality rate among cancers. Okay, only 8% of pancreatic cancer, right, does not occur within 5 years. Okay, this means that 92% of people, right, with pancreatic cancer will actually relapse within 5 years. Okay, lung cancer survival rate within 5 years is only 18%. Yeah, esophagus, right, cancer is at 19%, stomach cancer at 29%, brain cancer 30%, the ovarian cancer at 46%. So what are the chances that actually have what are the cancers, right, that actually have more than 50% with a 5-year survival rate? Okay. Colon cancer at 65%, cervical cancer at 68%, kidney cancer at 74%, bladder cancer at 78%. Okay. Okay, now that medical science is actually getting more and more advanced, okay, which cancer, right, has actually more than 80% with a 5-year survival rate? Okay, this includes, right, uterine cancer at 85%, Hodgkin lymphoma at 86%, breast cancer at 89%, okay, malignant melanoma at 91%, testicular cancer at 95%, okay, prostate cancer. Previously it was actually 76%, but now it's actually 98%. Okay, this prove that medical science is actually advancing, but we still cannot rely entirely on medical treatment. Okay, because the 5-year survival rate is not called recovery. It does not represent recovery. Okay, because it doesn't mean that there will be no recurrence at the 6th or 7th year. Therefore, as the saying goes, you have to fight it, right? You have to fight it for life once you've gotten cancer. So in fact, everybody, right, have actually cancer cells, and we have to fight it. We actually have to fight with it every day. Okay. Now we have understood that cancer, right, does not happen overnight. Okay. We have to discover it early by observing whether there are any abnormal changes or signs in our body. Okay. We should consult professional doctor for physical examination if there is any abnormality. All right, let's look at the next slide. So when a person is diagnosed with cancer, okay, they usually will actually look for treatment. Okay, and the treatment methods that doctors provide are the ones that I actually mentioned earlier. Okay, like surgery, electrotherapy, chemotherapy, and so on. Okay, at present, we already know that all surgery have risks, and the treatment of all this and all this cancer, right, will also bring along side effects and causing complication. Okay, and also, right, the successful treatments rate is actually not high for some difficult to treat cancers. Okay, this cancer treatment, right, may be able to improve. Okay, these cancer treatments may be able to actually improve the survival rate of cancer patients. But have you ever wondered what kind of price they actually have to pay? Sometimes right, treatment only help to prolong patients' life for a few months or maybe a few years. But does this really improve the patient's quality of life? Okay. So in fact, doing prevention and early detection and early treatment, right, are still the best way, right, to actually fight cancer. Let's look at the next slide. Okay, in fact, preventive healthcare includes regular health checkups and proper health education. This in turn, right, can help to avoid cancer and other deadly diseases. Okay. Actually, more and more evidence showing that nutritional immunology, which is a preventive side, is actually the key role. Okay, we actually become a key role in the fight against cancer. Okay, through adequate sleep, moderate exercise, happy mood, balanced diet, and maintaining a healthy immune system. This is the most reliable and fastest way, right, to actually fight cancer without any side effects. All right. Okay, in fact, why do we need to understand about cancer? Because we actually want to prevent the world number 2 killer, which is cancer, from happening. Okay, we can actually prevent most of this disease from happening as long as we can prevent cancer. So with this, my sharing ends here. I wish all of you, right, good health and longevity. Thank you.
Thank you so much, Charlie, for sharing with us so much information about cancer and also the side effect. Yeah, so indeed, actually all this information is really good to let our family members to know. So yeah, so for the next second part of the session, definitely we just want to find out, is there anyone who actually win back his health or her health after actually consuming products from Elite? So actually for today, I will really happy that I would like to invite Darren to share the testimonial on behalf of his father. But over here, I would like to seek everyone's cooperation by not taking any photos or personal video during the testimonial sharing. Thank you. So let's put our hands together and welcome Darren.
Thank you, Dawn. Hello, everyone. I'm Darren. I'll be sharing a medical issue my dad has. So back in November 2017, during an annual health screening review, the GP reviewed that there is a mass detected at the bottom of his lung area. However, no action was taken then since there wasn't any other symptoms showing. So by the way, my dad has a list of other issues such as like hypertension, high cholesterol, diabetes since many years ago. 1 year later, after in November 2018, after similar health screening review, similar mass was again detected by the same GP. And at the same time, the GP was also concerned about a drop in his weight. The GP then referred him to SGH for more tests. So after many rounds of tests, including a CT scan on February 2019, it was finally found that the unknown mass was in fact residing in the fundus area of the stomach, measuring 2.7 cm. And endoscopy result in August 2019 revealed that there's a GIST along the greater curve near the fundus. So following is the medical description of a GIST. Let me just show a slide. So by the way, GIST stands for gastrointestinal stroma tumor. So GIST can be malignant or benign, and even a benign GIST can become malignant as it gets bigger. So gastrostroma tumor is actually a disease in which abnormal cells form in the tissue of the gastrointestinal tract. So, and you can see over here, some gastrointestinal stroma tumors grow slowly over time and never cause a problem for a patient, while others can grow and spread very quickly. So for my dad, it's slowly lah. So next, let me show you slides on where the fundus area is. So you can see here, this is the whole stomach and the fundus area is over here. So this is also the location of the GIST. Yeah. And this is a slide from the CT scan where it shows the 2.7 cm dimension that was detected. Yeah. So at the same time, the biopsy also has a few images. So this is from the biopsy, and you can see here, this is the GIST that was detected, 2.7 cm. Yeah. So at the same time, the biopsy showed the GIST is benign at the time, meaning non-cancerous. Yeah. So after the endoscopy, the specialist in SGH recommended that usually for a GIST size that has reached 2.7 cm. Sorry. So a size that has reached usually is recommended that once it's reached 2.8 cm or larger, it will be recommending for removal of the affected area. An area which is larger that may then be removed totally. So meaning surrounding cell will not be reinfecting or reoccur again. So that will also means removal a large percentage of the fundus area, or in general term, right, a substantial portion of my dad's stomach. The side effect after the operation, according to a specialist, would be that it will affect his appetite, so meaning smaller appetite. In addition, according to the surgeon we consulted with in 2019, which at the time my dad's age is 76, right? There's a huge risk of complication during such surgery. Also considered as a major surgery for him at such an age with other condition that he already had. The surgeon and the specialist had given my dad actually two options. So one is to go ahead with the operation, which will eliminate any kind of future worries that the tumor will turn cancerous. Number two is to monitor and play by book. That is, if there's no change in size or it became smaller, then it means it remained benign, then no action is needed. So we selected option two and have CT scan yearly to monitor the GIST. So at around the same period before the endoscopy, around April 2019, we also got to know about nutritional immunology through family friend. Yeah. So let me show a slide. So in February, so at that time, my dad has been taking the full nourishment series, but consumed 3 sachets of the immunity, and also about 60 ml per day for the Rositime and Rhapsody. These are daily. And in February 2020, that's last year, almost 1 year after consuming the full nourishment series, he went for his yearly CT scan again. At this time, the specialist remarked that there's no action that is needed as the tumor remained very stable and actually reduced slightly in size. Largest is at 2.4 cm instead of the 2.7 cm back in 2019. The same options for the surgery is still being available, but it's not recommended as his age. Let me show you his 2020 CT scan result. So this is the CT scan result in 2020. So although the GIST, right, it didn't exactly diminish, but it wasn't a bad result to me and to us, considering that the GIST didn't get any bigger until 2.8 cm, and then the specialist has to recommend the surgery. So at this stable reduced site, it also means the tumor remain benign. So since the CT scan result in 2020, my dad continued to consume the 3 sachets of immunity, and then 60 ml of Lucityme and Rexulti, and 1 sachet of soy green daily. He also consumed a sachet of Soy Pro daily before his workout in the morning. And earlier this year, in February 2021, he had his annual CT scan again. And this time the GIST remains at still 2.4 cm, and this time the specialist has recommended the CT scan to be done once every 2 years instead of the annually CT scan, given that it's stable after 2 years already. So we insisted on yearly check, however. Although there isn't significant improvement since last year, we believe change in lifestyle and with knowledge of nutritional immunology will enable my dad to regain his health eventually. So starting from this month, my dad actually made this dietary change to become vegetarian as well. So we believe we will be seeing better result next year. So this is my sharing. And lastly, I'd like to thank Dr. Chen and for her remarkable research and the product, and also my upline for introducing my family to nutritional immunology. Thank you.
Thank you so much, Darren, for sharing with us your father testimonial. So congratulations to your father and also the whole family, because you all believe in the science of nutritional immunology. So Darren also mentioned just now that the whole family believe the changing of lifestyle and dietary to regain back the health. So indeed, our health is our wealth. So we must never ignore small symptoms, which our body is trying to tell us. We must actually find the root of the problems and nourish it with the right fighting nutrients, as mentioned by Darren. So, okay, so some disclaimer over here. So every product is specializedly formulated to nourish the overall body, including our immune system. However, our products are not in any way a form of medication or drugs and should not be used to treat or cure illnesses. Yes, so actually right now, we will actually have our Q&A session. So if you do not wish to on your mic, you may use the chat function to type in your questions, or you may also unmute, just introduce yourself first and then ask your question. So let's also limit to 1 question per person. All right, so over here, anybody who want to ask a question? Let me just look at the chat box also. Okay, in the chat box, I saw this question. I have a friend who is on medication and his doctor tells him not to take any health products. How should I encourage him to take Elite Global product? All right, thank you so much for your question. So Q&A team, is there someone who can actually answer this question?
Hi, MC. I'm Sing Chik, and I can help to answer this question.
Okay, thank you so much.
Okay, hi everyone. I'm Sing Chik. So first, we have to understand why doctors advise patients to avoid health products. This is because some manufacturers adulterate health products with banned ingredients such as steroids and diuretics to products, and to produce effects causing reactions or drug overdose for patients on medications. So for patient safety, most doctors will advise them to avoid health products. We can tell our friends that doctors and nutritional immunology products perform different functions, and they are not replacement for each other. So let me show you some slides for your better understanding. So there are differences between medical science and preventive science. Under medical science, a doctor uses his professional knowledge to diagnose the cause of illnesses, prescribe medications to suppress symptoms, reduce discomfort, temporarily replace body functions such as reduce blood pressure or cholesterol level by using heart medications, stop bacterial infection by using antibiotics, and etc. Doctors will also perform treatments such as surgery, radiation therapy, or chemotherapy to help patients to control specific diseases. In emergency situations, doctor can help patients to stabilize or control conditions. They are necessary and cannot be replaced. However, all medications and treatments have side effects. Take for example, the chemotherapy treatment. Chemotherapy treatment works based on the characteristic of malignant cancer, whereby cancer cells are fast-growing cells. Chemotherapy uses cytotoxic drugs to kill fast-growing cells like cancer cells. However, there are other healthy fast-growing cells which can also be harmed. Hence, the side effects of chemotherapy are hair loss, fatigue, nausea, vomiting, rashes, depression, throat inflammation, nosebleeds, weight loss, and anemia. On the other hand, Elite Global products are developed based on the principle of nutritional immunology, which is under the preventive science. So nutritional immunology highlights that the best doctor in the world is our immune system, which protects us against diseases. So most diseases are related to malfunctioning of the immune system. The immune system consists of several different organs, many types of immune cells and immune chemicals working together in a well-oiled harmony. So a healthy immune system will perform optimal functions of defense, cleanse, and repair. For defense function, one type of immune cells called natural killer cells, or NK cells in short, can kill any type of cancer cells without producing any side effects. As for cleansing function, macrophages engulf and clear away aged cells and foreign particles. Function of the immune system is repair. The immune system is involved in repairing damaged tissues and organs in our body. So according to research, besides basic nutrition, there are 3 other types of important nutrients that the immune system needs for optimal function. These are phytochemicals, antioxidants, and polysaccharides. So based on nutritional immunology experts, 30 years of research, it shows that cactus is a high phytochemical superfood. Cactus contains more than 10,000 phytochemicals, which can inhibit formation and growth of tumor, stop mechanisms that lead to tumor development, neutralize cancer-causing hormones, and inhibit cancer cell formation and metastasis, which is prevent the spreading. Cactus also can nourish immune system. Next, the high antioxidant superfood is rose. The high amount of antioxidant in rose can prevent DNA damage from free radicals, slow down signs of aging, promote cell repairing, enhance collagen production, prevent cancer cells metastasis, strengthens the immune system. According to 30 years of research by nutritional immunology experts, it shows that mushrooms are the superfood which are high in a variety of polysaccharides. So polysaccharides-rich mushrooms are apian mushroom, maitake mushroom, shiitake mushroom, and cordyceps mycelium. So a variety of polysaccharides can stimulate productions of interferon and interleukin. It also increases NK cells activities by up to 49-fold. Polysaccharides also can destroy existing cancer cells, protects healthy cells from becoming cancerous, inhibit tumor growth. So all these precious and beneficial ingredients packed with phytochemicals, antioxidants, and polysaccharides can be found in Elite Global products. Other than nutrition, we should have a healthy lifestyle in order to maintain a healthy immune system. This includes to do a moderate amount of exercise, adopt a positive attitude, ensure sufficient rest and sleep, take a balanced diet and with plenty of wholesome plant food. So Elite Global products nourish the immune system with wholesome, pure nutrition so that the immune system can resume defense, cleansing, and repair functions to recover from the disease and maintain good health. However, it takes time for cells to resume these functions. So complementing nutritional immunology products with medication to control illness and at the same time restore the immune system functions is very important. This will eliminate the need for medication when the body regains back normal functioning. Medication and treatments are not nourishment, have side effects, and cannot be used for maintaining a healthy immune system. So Elite Global products do not contain drugs and have a clean safety records. So if a doctor objects a product consumption without checking ingredients, a consumer can show the ingredient list of Elite products to doctor. So I believe that doctors who understand the ingredients and the principle of the Elite Global products will agree that they are safe and not object to their usage. Last but not least, our health is our own responsibility and not others. So it requires knowledge and wisdom to discern and to decide on choices for our health and life. So my sharing ends here. I hope I have answered the question. Thank you.
Thank you so much, Xin-Chi. Yeah, really, actually for all Elite products, it's actually developed based on the principle of nutritional immunology. Yes, so really do encourage the understanding of the Elite product to the friend. All right, so just let me check the chat box again. Okay, let me see if we have any other questions. Okay, so if we do not have any more questions, we will actually end our Q&A session right now. So